Are you one of the many millions of Americans struggling with diabetes and its effect on your feet? Too often, diabetic foot complications lead to long-term disabling outcomes, infections, or worse. I'm Houston Podiatrist Dr. Andrew Schneider. My practice is proud to announce a new Comprehensive Diabetic Foot Evaluation. Our team is equipped with the latest diagnostic tools that help us evaluate and treat diabetic feet successfully. In this video, I'll discuss in greater detail our unique approach to diabetic care. Before I do, I wrote a book all about diabetic foot health. I'm happy to send it to you for free. You can order it at www.diabeticfootbook.com. The link is in the description. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Preventing diabetic foot problems is incredibly important because they can lead to serious and long-term complications. Diabetes can cause nerve damage in the feet, leading to numbness and tingling sensations, as well as reducing blood flow, which makes it easier for wounds to form, harder for them to heal, and increases the risk of infection. In extreme cases, diabetes can even lead to amputation of the affected limb. Therefore, it's essential that those with diabetes take steps to prevent these issues from occurring in order to maintain their quality of life. My Houston practice, Tanglewood Foot Specialists, and Arche Healthcare have partnered to provide our patients the best and most comprehensive diabetic foot evaluation available. We understand there's no one-size-fits-all approach to managing diabetes, and that's why the new Comprehensive Diabetic Foot Evaluation provides a source of information vital to creating an effective plan uniquely tailored to every patient's individual needs. The Arche Healthcare Diabetic Foot Evaluation is a great benefit to patients with diabetes. This comprehensive evaluation will provide the necessary information to create an effective plan tailored to each patient's individual needs. It will also help to identify any potential problems before they become serious, allowing for early intervention and prevention of long-term complications. Additionally, this evaluation can help patients better understand their condition and how to manage it in order to maintain their quality of life. With this new evaluation, diabetic patients can have peace of mind knowing that their feet are being monitored and cared for properly. First, a comprehensive physical exam is performed. A physical exam of the feet is conducted to check for any signs of infection, swelling, wounds, deformities, or other abnormalities. Next, we'll assess the nerve function. This test measures the nerve function in the feet and legs to detect any nerve damage caused by diabetes. To accomplish this, we use a few tools. The Neuropad is a tool used to assess autonomic nerve status in the feet and legs. This test measures the nerve function by assessing the level of moisture in the foot. It's non-invasive and provides accurate results quickly. With this tool, we can identify factors that indicate diabetic neuropathy. The Dermastat is another tool used to detect autonomic diabetic neuropathy. This digital device assesses skin moisture levels, and the results are provided instantly. We also want to assess the sensory nerves, since diabetic neuropathy can result in the feet feeling numb. To accomplish this, we use the Vibratip, which uses vibration to assess sensation. Vibration is an effective way to assess diabetic sensory neuropathy because it allows us to measure the level of sensation in the feet. This is important because nerve damage caused by diabetes can lead to numbness or tingling sensations, which can be difficult to detect with a physical exam. Using the Vibratip, it stimulates the nerves and measures their response, providing an accurate assessment of the patient's sensation levels. We also use a monofilament to assess sensation in the feet. A monofilament is an effective tool for assessing sensation in the diabetic foot because it applies a light, consistent pressure to the skin. This allows us to measure the patient's response and detect any areas of decreased sensation that may be indicative of nerve damage caused by diabetes. The next step in the diabetic foot evaluation is an assessment that evaluates the blood flow in the feet and legs to determine if there are any areas of decreased circulation that could lead to potential problems down the line. We do this in two ways. First, we'll use a digital device called the IR stat. This uses infrared technology to identify temperature changes in each foot. When there's decreased circulation, the temperature of the affected area will be lower than normal. We'll also assess the blood flow using a test called the ankle brachial index, or ABI. This is a test used to measure the blood pressure in the feet and legs. It's performed by measuring the systolic blood pressure at both the ankle and the arm, then dividing the ankle pressure by the arm pressure. The results of this test indicates how well the blood is flowing through the arteries in the lower extremities. If there's decreased circulation, it can be an indication of peripheral artery disease or other vascular issues that can lead to serious complications if not addressed. Finally, we'll assess the mechanics of your feet. The pressure stat is a tool that we use to identify areas of high pressure in both feet. The high pressure areas are at risk to break down and form diabetic foot ulcers. That's exactly what we're trying to prevent. We'll also measure your feet to ensure that you're wearing shoes that are properly fitting. So what do we do with this information? After the examination, you'll receive a personalized portfolio showing the results of the tests that were performed. It also contains valuable information on how you best can care for your feet to prevent diabetic foot issues. We also may recommend shoes and insoles that are specialized for diabetics. They are well-fitting shoes in both length and width. They have extra depth to prevent areas of pressure. The insoles help to manage any areas of high pressure to ensure they don't break down and form ulcers. I also may recommend advanced insoles that provide temperature monitoring. These insoles provide data about changes in the temperature of your feet to provide early warning if there's a sudden increase. An increase in temperature can indicate infection and the start of a diabetic foot ulcer. These insoles are instrumental in allowing us to take measures to prevent one from forming. We will be identifying our patients to perform this comprehensive diabetic foot evaluation to help reduce diabetic foot complications. By allowing us to identify risks early on, we can develop treatment plans that prevent infection, preserve mobility, and improve your quality of life. After all, prevention is always better than a cure. So let's start taking better care of our feet today. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Don't forget to order my free book about diabetic foot health. I'm happy to send it to you at no charge. You can order it at www.diabeticfootbook.com. If you have diabetes and are concerned that you have a foot problem or just want to prevent one from forming, contact our office and we'll get you in for an assessment. That link is also in the description. Thanks so much for watching and have a great day.